With Veterans Day just around the corner, we want to highlight the importance of access to quality mental health care, more specifically for women veterans. Joining us today is Colleen Kaiser. She's a licensed counselor with ThriveWorks and a Navy veteran. So first off, Colleen, thank you so much for your service. When did you serve?
I served in '89 to '93.
Wow, thank you so much. I really appreciate you and your family and all the sacrifices you do to protect us and our freedoms here in this country. But when you got back, well, to civilian life, was that a hard transition for you?
It can be difficult because you're used to the structure and the camaraderie that you have with the other military members, and then you get out and you're sort of trying to fit back in, and things work a little more casually in the civilian world, so you kind of don't have that same support, that same understanding. So it can be a tricky transition.
So when you were in the military, did you ever feel like you yourself had challenges while you were serving, and did that lead you down this path to be a licensed counselor?
I definitely faced a lot of challenges. I think it was a wonderful learning experience, but there were also some times that it was challenging and difficult. I did meet a counselor when I was in the Navy that kind of made an impact on me, and I sort of kind of went from there once I got back out of the military and went back to college and started doing all that. So yeah, I was directed in that way to help other people.
Yeah, so as a licensed professional now, with your background in the Navy, you do help a lot of women in the military. And one of the big issues, depression, PTSD, but also sexual assault in the military. And you recently wrote an op-ed for the Houston Chronicle on your experience in that. Can you tell us more about that?
Yeah, so I worked at the Norfolk Naval Base, and I worked with a man in my office, and he would often make inappropriate comments, and always kind of questioning my relationship with my husband. And one day he actually really stepped over the line, and he kind of put his hands on me and was making rude remarks. And when I reported it, I was basically told, well, he's retiring, we don't want to tarnish his exit from the military, and so we need you to just kind of stop. And so, yeah.
So did you wind up reporting it?
I did report it, but again, I was just told we're not really going to do anything, and so you need to just kind of get over it. And he's leaving in like a month, so.
I kind of feel like women, we have this mindset of not wanting to ruffle feathers.
Yeah.
And how can we get over that? How can veterans and women coming out of the military now get the help that they need so they don't feel like they're the person that's doing the wrong?
Well, I think we have to keep standing up for ourselves and each other, supporting each other. I think the VA has done a really good job of hearing the women veterans, even though we're a really small percentage of the community. I think they have really started to understand that we have unique needs. They have the Women's Veteran Call Center, where if a woman feels like she'd be more comfortable having somebody advocating for her that really understands her viewpoint and is compassionate to her situation. So they're doing better with that. I think reaching out and talking to your friends and your family and letting them know how you feel, and if you have a veteran in your life and you see that they're struggling, you can reach out and contact the VA too to help them find the support that they need.
Yeah, we talked a little bit about this earlier. We only have a few seconds here, but women express their need for help differently than men do. Men do the substance abuse route, women kind of hold it in. Yes. But if women are holding it in, where can they go to find help?
Well, they can call ThriveWorks. They can call. There's a lot more telehealth online. So if it's access, like driving downtown, you can get onto va.gov. That's another way to find assistants, and any of the people that answer the phone can direct you to exactly who you need to speak to.
Yeah, and we're showing you right here at thriveworks.com, which
yes.
is where you work through. So if
Yes.
you want to get a hold with Dr. Kaiser or any other of the psychologists there or counselors there, head on over to thriveworks.com. We have additional resources on our website, cw39.com.